Saeed and the team here. A really privileged and honored to be here today, and super excited. This is the first show I believe you mentioned. So about me, first of all, born and raised in Nepal. Did my all schooling in Nepal, Dharan, which is eastern part of Nepal, and then I came to United States in 2006. I've been here for 18 years. So by trade, I'm a physician for more than 18 years in the United States. My specialty is I'm a primary care physician. I see from grave to like 93 years old patient I saw yesterday actually. So focus on basically my primary focus right now is lifestyle medicine, trying to figure out how we can help people with chronic disease with just simple lifestyle changes. So that's number one. Number two, I'm founder of my nonprofit Dana Yoga Foundation, which is basically one of my main passion behind everything I do to ultimately to build a hospital focused on diabetes care and a school for blinds and orphanages and hopefully impact a billions of life in my lifetime. And then, and I'm also a founder of Avatar Equity, which is a private real estate equity firm, which I'm super excited that we have done a couple of projects in Florida last year. And then also we are actually doing a new fund this year, real estate, focusing on green affordable wellness community. We're gonna do $100 million project this year alone with that. And then also I have a podcast called Dream Big and Think Different, which you can see in my background. And I'm also author. I wrote a book, a chapter in the book. Persistent Pivot and Game Changer is an Amazon bestseller. And I'm blessed with two kids. My son will be 13, actually having a birthday party this weekend, and my daughter is 9 years old. That's about me. To be honest, there are a couple of challenges I want to just mention, but I've been again here for 18 years. When I started practicing here in 2007, I started a residency. It's definitely what I found for me personal challenge was, the system I have to learn from Nepal and here is completely different. The healthcare, how they manage chronic disease, especially, diabetes, high blood pressure, cholesterol, those kind of thing. So in 3 years, we were still a paper, like, doing in paper form and digging history and all that. So the time, like, a lot of consuming and all, taking a chronic disease to acute illness as a being primary care. And they shifted to something called electronic medical records, EHR. That has been actually good or bad, but one of the challenges right now we're having with electronic health record is above the, like, you take home your work, basically meaning when you see the patient, you'll be like almost 50% you'll be just with the computer. And guess what?
Right.
We have 50% for the patient to talk about why they're here and those kind of things. So that's number one challenge right now. And again, chronic disease, I mentioned, it's basically people only have the patient and doctor, they have only like 15 minutes of time, and I
Right.
hope there will be more time to discuss. And lastly, the challenge I am facing right now is basically people coming to the appointment, which is sometimes we have like 7, 8 patients not showing because they're not able to come to the appointment. So those are the few challenges we have. That's a very good question, and I was thinking of about, like, when you sort of mentioned about COVID. Personally, we all have been affected, not only healthcare, right? We all know about that. Personally, for first 3 months, I mean, nobody knew what's going to happen, and I was myself sitting home, right, for 3 months, basically no income, right? I mean, there was no patient. Absolutely. That's a for chronic disease. The one of the thing, it's a continuity of care. So basically, if you have diabetes, high blood pressure, cholesterol, minimum, I think the patient should see doctor at least 4 months. To check your cholesterol, to check their blood pressure, all those stuff because it's a silent killer, I call. Diabetes,
Right.
high blood pressure, cholesterol. If you don't show up in your appointment and don't have some kind of monitoring of the blood pressure and all that, the continuity care is important. And what happens is if the patient knows so for that appointment, let's say I have 20 patients a day, and let's say normally I think in my there's at least 1 or 2 patients every day that's missed appointment. It could be due to, I mean, for me, I was doing some research on why people are not showing. and believe it or not, and one of the reason is transportation, and I think that's going to be a major, because the people we see, 60 more than 60% Medicare patient, and a lot of them are 65 and above, and there are other health issues that, I mean, chronic disease again. I'm mentioning high blood pressure, cholesterol, diabetes, kidney problem, dementia, a lot of need, and transportation, believe it or not, is going to play a big role. And so workflow, I mentioned continuity of care. Those are the major, and the biggest challenge, I mean, will be because of no-show. There's a financially, is gonna be a big problem for us, because you do the math. We have, let's say, two patient no-show every day, or one patient, whatever. It's a lot of, like, in a whole week. We're talking about, let's say, I don't know, they begin number one patient a day, seven patient a week, and you do the math. It's a lot of no show, and
Yeah.
it's also important, because if that slot is specifically for that patient, somebody else can come to that slot. It's a lot of workflow problems, and no show is a big problem. That's another great question. I have not done personally research, but what I can say is I roughly see about 20 to 30 patients a day. And average primary care doctors, that's on average. And 60%, is Medicare. And as I said before, a lot of them require some kind of assistant, like they have problem with the hip, problem with the knee, some kind of chronic disease like kidney failure, requiring a dialysis, and they have to come 3 times a week. It's a I think it could be not only almost 50%, but there are quite a bit of people, I would say, requiring those kind of assistant, some kind of assistant. I don't know exact number, which I can probably do some research and get back to you. But at this
Sure.
point, it's a fairly good amount of people requiring those kind of systems. The medical transportation is believe it or not, again, when I heard about the system, I was thinking, wow, this is amazing. This is gonna definitely not only help a patient, which is the primary goal here, to keep their appointment, but what Safr does, I think it's everyone needs to hear, is it's a platform for not only for the patient, for medical community, the insurance company, and transportation. So it's all one stop shop kind of integrated system or platform that everyone is connected seamlessly, and is also connected with the EHR, our electronic medical records, and it's a no brainer. I mean, it's so seamless and easy that you don't have to call, and it's time consuming to making those rides and all those things. And a Safer is going to be a game changer for sure, and solving the big $150 billion problem in this. Absolutely. So lastly, I would like to say there's three things for me personally. I believe that's a true wealth. Number one, I'm not being a doctor, but health. Health is number one. No matter what, who you are, I don't care how much money you have or who you are, president of the United States, whatever. But health is number one. Without health, we are nothing. So please be healthy. Just four pillars of health I call about: food, exercise, stress management, and quality of sleep. That's the number one. Number two would be family. Yeah, I'm a family guy. Without my dad and mom, I won't be here talking today. And family is, to me, is number two. Basically, family is everything for me. And lastly, freedom. Freedom of money, freedom of time, freedom of relationship, and freedom of purpose in life. So those are my messages, for everyone listening today. Hopefully that was helpful.